Deb, you are quite known well in the Indian circles among our electrophysiologists here that you are practicing in UK. We all are interested to know what took you to that particular stage wherever you are now, and then what are the opportunities in the United Kingdom for young electrophysiologists who are trying to make an opportunity here. And as I had mentioned at the top of the presentation, I emphasize that people who want to make this a career, I would encourage them to do part of training in India as you and me did, and part of the training abroad, so that they get exposed to the whole area of electrophysiology, both in India and the substrate in India and substrate abroad, so that when they come back to the country, they are well equipped to deal with all the latest. So, Deb, do you have certain slides, or I'm happy to play a few slides for you here? Can you introduce yourself and let us know what position are you in now?
Here, so am I allowed to share my screen?
Yeah, yeah. I don't know. I'm
So,
happy to. Oh, you have. Yeah.
yeah,
So, Kirti,
I've got
can
some.
you? Yeah, Kirti, can you enable Deb to share his screen, please? Yeah.
Yes, sir.
Yeah. So Deb, what we are doing now is recording this presentation. Again, we'll be sharing the presentation to all the registered people, and then you will be given a link as well. You can share the people to you so that you don't need to repeat this to anyone whom you think you want to share this information. Yeah.
Right, that's great.
Yeah.
So, I basically did my MBBS and MD from Kolkata. So I'm born and brought up there, and then I did my DM in cardiology in GSVM Kanpur. And then basically I decided not to go back to Kolkata and go to AIMS Rishikesh. So I think that was a step. I was a bit hesitant because AIMS Rishikesh was just budding at that time. But I went there, and it is good that there are not many cardiologists there, and I did to give lots of interventions, and also there are lots of networking happened. And because in AIMS, every month there are some international faculties used to come and some from the UK as well. And that's how I made a good connection with the UK faculties while I was in AIMS. And also another important thing, I mean, I know that everybody's talking about research. So in AIMS Rishikesh, I had the time to learn more about statistics. So I taught myself to do the coding with R. And that basically gave me an excellent edge. And I started to collaborate with the US electrophysiologists to do the collaborative meta-analysis. And I published nearly five high impact publications while I was in AIMS Rishikesh. So the thing how I came to UK is that basically I was doing mostly intervention. So I went to ESC Paris in 2019 to present my CTO paper, and basically there I met few guys from the UK, and also I was in touch with EP fellowship for Canada and Australia, and I spoke to them as well, and that's how from ESC Paris basically I thought that I'm getting a chance in the UK to come for fellowship. And that's how basically I came to UK in 2020, early in that year. So I started my journey from Wolverhampton, which is a tertiary hospital, and they do like 400, 500 EP procedures. But then the COVID happened, and of course that affected my training initially, but I was there for nearly 18 months, and I did nearly 200 EP and 200 devices. But of course, I wanted to do more EP, and then I got a chance in Liverpool Heart and Chest Hospital, which is the biggest EP volume center in the UK, because they do like 1500 EP procedure. It's the biggest in the Europe, basically. So I went there. I think that was a life-changing experience from there, because the EP was excellent, and I got to use all the different mapping system, Carto and Sight and Rhythmia. And then I came to Queen Elizabeth Hospital. So that is one of the biggest heart transplant centers. So lots of basically advanced heart failure steps and transplant ablations happens there, and they've got a very good team. So after that, I I thought that I was ready to take up a consultant post, and then I become a consultant in University Hospital of North Midlands. And currently I am visiting there, and also consultant in Chester Hospital. So basically, as a electrophysiologist in the UK, you have to do quite a bit of general cardiology as well. So any cardiologist in the UK does general cardiology plus something else. So that extra bit could be EP, could be intervention, could be imaging, but there is lots of demand for general cardiology in the UK. So that's how I came to UK, and that's how I stepped up the ladder. Um, so yes, EP is really booming in India. So I think even before 5 to 6 years back, there are not much of financed people or trained hands or EP with good technological centers were not there. But these centers are coming up, and people like Deep and other people are well trained from abroad, and they're coming back to UK to lead the service. So I think in India, EP is having a big boom. So I think as a young trainees and fellows, it's the right time to learn more advanced EP and come back to India and give your service. EP as a career has got an excellent work-life balance. What I believe is that there is no STEMI calls at night, and of course there are lots of technologies which I like, and it's very I would say intellectual. The EP understandings, the EP procedures, which always have been attracted me. Um, so I wanted to talk about that, how to get into EP in the UK. So when I was finishing my DM in 2018, I was trying to get a fellowship, and I was trying to the English speaking countries. So basically, for US, what I figured out is that I needed to do USMLE, which again have to give 3 exams. It also has to take a lot of money. So I didn't want to spend that much of time and money to get a AP fellowship in the US. The next option I tried for Canada. So for Canada also, I mean, our after your DM, you can go there for fellowship. There is no extra exams required. But again, you have to think about funding. So, I mean, either it has to be self-funded, that means you are already working in a hospital and the hospital is continuing your pay, and Canada will only give you some money from their research fund, which is not excellent. And I had family. So again, financially, if you want to go to Canada, so funding is the important thing which you should consider. It has to be funded from research or from industry. If you can manage from ICMR or something from Abbott, it will be helpful, and you will get the basic salary from that hospital in Canada. So and again, they will prefer those fellows who have the funding. So lots of people from the Middle East go to Canada because they are self-funded, because they'll be paid by their ministry. So then I tried for Australia and New Zealand. Again, the funding was a bit problem, and the centers are not very high volume. And that's how I chose for the UK Center, because in UK Center, whenever you get a job, either fellow or a trainee or a consultant, you will be paid equally by the NHS. That is the beauty of EP fellowship in the UK, that you will be paid equally, and the money is quite good. I mean, in Indian money, you will get like around 4,000. Sorry, so in UK one, it's 4,000 pounds, which is excellent to live in UK. So financially, you are quite stable in the UK, and you'll have excellent work-life balance, because of course in India, when we were in the training, there is no concept of how much hours you work. But in NHS, the contract will be for 40 hours a week. That means you will work for 8 hours a day. So your job start from 9 to 5 basically, and After that, you are free. You won't get any phone calls. Over the weekends, Saturdays, Sundays, you are free, so you can enjoy with your family. So the work-life balance is excellent, and also it's not just EP. Overall, the professional conduct and the patient care is very different in the UK, like the West. I mean, it's very comprehensive, and there are lots to learn basically. And they do have cardiac physiologists who are very knowledgeable, very experienced. I mean, that is something in India most centers lack. I know that maybe in Deep Center or someplace in Madras Medical Missions, they do have trained physiologists, but in UK, everywhere you will get trained physiologists. You will have specialist nurses like arrhythmia nurses. Lots of the patient's phone calls and queries are dealt by them, the nurses. And of course, there are sometimes you need to make some complex decisions, and for that, the phone call will come to you. But otherwise, most things will be filtered by the specialist nurses, and they're also very experienced. For research, so when I finished my MD, I already had 20 publications, including in BMJ. When I finished my MD, I had nearly 30 publications. By the time I went to UK, I had nearly 40 publications, including in big journals. So publications is very important. As they say that publish or perish. So in UK also to get a post in a good center competing with the UK trainees, it's always good to have publications. In UK, in the big centers like in Liverpool or Birmingham, they do have their PhD fellows, research fellows. They are not clinical posts, not like the Australia, which Dr. Pathak said that because the research fellows in the UK are 100% research basically. So there is no 50% research and 50% clinical here. Whereas the fellow posts are totally clinical with lots of hands-on experience. The other thing I want to mention about the UK centers is that in UK, in big centers, so EP guys only do EP. They don't do much complex devices. So the device and heart failure is a separate team, and EP is a separate team. Like in Liverpool, there are so much of pressure in NHS with 1,500 cases of EP. So they don't their focus will be mostly on EP. So if somebody from the India wants to train both in EP and equally in devices, you have to go to a center who does both of them together because the operators are different. And of course, at the time of your EP or device fellowships, you won't be doing stents unless you're on call and you can do some stents at that time. The EP experience is very holistic. You will get to do, all sorts of ablations. AF ablation is the bread and butter. Left atrial appendage occlusion is not that much happening in the UK except in few centers. I was trained in Liverpool, so they are the highest appendage occluder implanted in the UK. But again, not much cases because UK is very evidence-based, and still the guidelines for appendage occluder is 2A or 2B, so NHS don't think they're very much cost effective overall. Ice is also not available everywhere, but in Birmingham and Liverpool, we used to use lots of ices, especially for the VT cases. For AF ablations, we don't use ices because it's again expensive and it's not required. I know that in centers in the US, they use ice for all the transeptal. We don't do that in the UK. We do transeptal based on fluoro. So, of course, ethical practice is something which I learned in the UK. So we always practice the guideline, the evidence-based ones. Sorry. So how to come to UK? So you have to, I think, you have to think upfront that what do you want to do? If you want to come to UK, learn and go back, the best pathway would be to complete your MRCP in India and have a GMC number and then apply for fellowship. You can. you can come for a fellowship even without MRCP as well. I mean, some centers will sponsor your GMC registration even without MRCP, especially if you are already done your MD and DM. I also came to UK without my MRCP at that time. But of course, if you have got MRCP, you will have more options. And the other path, if you want to come to the UK and stay and settle in the UK, then I think the best option would be to come to the UK as a junior person and do your MRCP, have some years of experience, and get into the training post. So the training as a cardiologist in the UK is for totally 8 years. So they call it ST4 to ST8. So after your MD, if you're coming to the UK, so you will start from ST4 and then you have to spend 5 years to ST8. Even after if you want to come after DM as well, again, get into the training system, you have to start from ST4. So I had to choose between that whether I want to start as ST4 and do the core cardiology, echo, and everything again. But I thought that that's not for me. So I just chose to do specially EP for last 4 or 5 years before I became consultant here. There is a pathway to do that, which I went through called Caesar. It's an extremely hard nut to crack. So I wouldn't recommend that. But of course, that is an option that you can use your Indian qualifications and your UK experience together to make a Caesar application. And you can become consultant like I became. But again, it's extremely difficult, challenging, and somewhat restrictive. The other thing is that I heard that Dr. Pathak also mentioned that EP is very financially rewarding. That's probably very much true for India because in India there are not many trained hands in EP in complex EP specifically. So for the 3D mapping, AF ablation, VT ablation, so for that training, not everyone is. But in the UK, everyone gets same salary. So even if you are an experienced physiologist or you just do imaging like TOE or cardiac MRI or intervention, everyone gets same salary. So that's somewhat beauty of the UK that nobody has to work too hard to earn the money, and the salary is extremely good, and you live a very decent life. The other thing which I did in the UK is that there are some accreditation exams for EP and devices. It can be from British Heart Rhythm Society or European Heart Rhythm Association or the US-based IBHRA. So I did all the 6 exams. So that gave me a competitive edge in this country. I'm not recommending you to give all these exams, but of course, the IBHRE, the CEPS and CCDS are quite internationally accepted and recognized exam, and I would strongly advise to take up these exams and get them into your CV. How UK health system works? Basically, there are tertiary hospitals where the ablations happen, and UK actually follows a spoke and hub model, that there are district general hospitals and there are GP. So GP sees the patient. So if somebody is having palpitation, they first have to go to GP, and GP will refer to a cardiologist based in district general hospital, and he will refer the patient for ablation to the tertiary hospital for ablation. So that process takes a long time in the UK. I mean, when I see patients for AF ablation in the clinic, they are already waiting for 12 months or more. So the waiting list for ablation in the UK is very, very long. And we believe that UK should have more tertiary centers and more EP operators. But of course, the EP is a very saturated field in the UK. So what happens because of that is that the UK trainees don't want to do EP anymore. So and that's how the EP fellowship comes. So when you are basically looking for jobs in EP in the UK, you have to think that which hospital you want to go. And so the way to search for jobs in the UK is to go to NHS jobs and just search for electrophysiology fellow or like senior clinical fellow, and you will have list of jobs going on, and you will have the contact person's email address in there. What I would advise is that you should first email that contact person with your CV and expressing your interest that that's my CV, I want to do this, is there an option? And then he will be able to guide you. So usually in the centers, especially in London, there are so many trainees that, I mean, each trainee gets very less to do anyway. So sometimes they don't need fellows. I know that in St. Bart and in Brompton, they do have international EP fellowship, but I wouldn't recommend them because you wouldn't get to do a lot hands-on there. And the cost of living in London is extremely high. It's double of the rest of the UK. So you wouldn't be able to live quality life there. If you go a bit south, like Bournemouth, they do have a overseas EP fellowship, and it's quite good. The numbers are not excellent, but it's a good place, and they do take intake EP fellows from overseas. So, and again, Liverpool is the biggest center, and again, like 1,500 cases they do, and even as a fellow, I did 250 ablations there. Lots of hands-on, very good center to go. Again, when the job comes up, it's very competitive because everyone in the UK also want to go to Liverpool to get their fellowship. So you have to compete, and if you have accreditation exams done or publications or previous UK experiences, you will have preference. In Birmingham, so Birmingham's center, which I did from also, is a big military center. So every year from Pakistan, basically one or two guys come there for 2 years fellowship. Again, they are self-funded. So their Pakistan organizations basically keep them the payment. So Birmingham doesn't have to pay them. But again, that's again a very big center, uh, very good hands-on. You will get to do again 250 to 300 ablations there. There are centers in Newcastle, Freeman, and in Manchester, which you can try. They also take overseas people, and now the with the UK system, they don't have much trainees, so they are looking for fellows. But I think if you have got your MRCP done, GMC done, has got research, and the job is out, you have contacted the person, and you should have chances to get there. And to repeat, whenever you get a job in NHS, you'll get paid as same as the trainees are paid there. So I think I've covered all this part. Some people are worried, and also I was, that if you are coming to UK, how much will be the hands-on? I would say it's all hands-on. So the teaching and training in the UK is out of the world. So here basically among the consultants, there is no hierarchy. So everybody is a consultant cardiologist. There is no hierarchy of professor, associate professor, assistant professor. So everybody is a consultant. So when you get to do the cases, you will be the first operator, and your consultant will probably stand next to you, teaching you, giving you the tips for every steps. And gradually, once you get confident, then probably he will just get scrubbed or just stand outside or maybe sit in the console or just do their paperwork. So they wouldn't come once you are comfortable and they see that yes, you can do the cases without any complications. So it's extremely hands-on. I mean, I would say that your hands-on will be more than what you're going to expect from any EP fellowships in India, even in the big centers. So and again, the consultants and your supervisors are committed to your teaching and training. So like every couple of months you will have meeting that what's your goals of being trained and what you have achieved and what next to go. So all this structured training program is available in the UK, which is extremely good. So I think with that I would like to stop and That's my contact, and Deep has got my contact as well. And if there are any necessary you want, you can contact me or to Deep. I'm happy to answer these calls. Thank you, Deep. I will stop sharing.
Dibs, that was great. Thank you so much, mate. Again, at this point of morning, early morning. So that was it was like coming from your bottom of your heart, all that you did over the years. This is invaluable information, Dibs. See, early in your early career days, you would have imagined how much you had to work to get this information, right? Probably you might not even got this information. You searched
No.
all this yourself. You do it all the homework yourself. You worked hard to get well. That's what I did to get into Australia as well. So as seniors, I think it is right for us to put all of this on a plate and give it to our juniors. And it's up to them. We can only serve the food. It's up to them if they want to eat it or not. Yes, wonderful insights that you gave, and importantly, how academics is always a part of it, and how important you are right from the start of your career, publications as a cardiology trainee, and then how good the work atmosphere in UK is, and of course, money is not a problem at all, be it in India, Australia, UK, US, wherever. As an electrophysiology career, money is not going to be a problem at all because there is a lot of demand in this field. There's so much of demand in this field, and not many electrophysiologists there in the whole world, leave alone India. Thank you, Dibs. I will be speaking to you in person on phone. Thanks so much again, mate. Yeah.
Thank you, Deep. Thanks
Bye,
for the
bye, bye.